dresses and then they don't want to go down. That's another big problem. That's why I always tell my patients, in the house, ensure that you're wearing clothes where you can just get up and go. Wear your tracks so that even if you're lazy to go, you will be motivated to go out. But the moment you shift into, if you change into a night dress, then you're definitely going to be sitting at home. The more you're going to be sitting at home, the more you're going to be eating, because you'll keep going to the kitchen and coming back. And then the more food that will go in. So that is all a problem. Post-menopausal in women. In women, we see that post-menopause, the amount of fat around the belly actually increases, and that's why she needs to be more careful post-menopause, that she needs to eat more healthy and she needs to work out more. Stress, again, there are people who think that eating too much rice increases the fat around the stomach, or my stomach, I'm getting a paunch because I'm eating too much of rice. Is it true? Okay, not really true. Okay, if you eat excess, yes, it will increase your paunch. What is most important is if you're not able to identify. Yes, we need to see. Yes, but again, if it is only above, the recommended amounts, if it is fitting in the budget, then not necessarily. What could also be a factor, if you're not able to identify, if you're active, if you're eating healthy, if you're doing everything which is healthy, then another thing that you need to identify is, are you stressed? Because in stress, the hormones which are, secreted in stress, the epinephrine, norepinephrine, your cortisol, all that goes and increases the amount of fat deposition around the abdomen. And that is why today we recommend yoga to people who are stressed, because it helps to relax the mind. Automatically the stress levels will come down and your tummy comes under control. So that is something you need to identify. Yes, but you need to exercise, yes. But what I said is, suppose you are exercising, you are eating healthy, you're doing everything right, and still you're developing a paunch, then it could be that stress is causing that paunch to develop. Then at that point of time, meditation, relaxation would help. Another important factor which most of us miss, and today's generation is most affected, is sleep. I was just discussing with her before the session started. If you see most people today, the working individuals, if you ask them that how many hours do you sleep? Can I know from you all how many hours do you all sleep? 6 to 7 hours? 6 hours? 6 hours? There is a study which says that if you sleep for less than 7.5 hours a day, your risk for lifestyle problems is actually increased. So you need to get adequate sleep, because if you sleep less, you will gain more fat. Even the sugars go uncontrolled because of sleeping less. Your cholesterol, your blood pressure, everything goes for a toss. So it's very important to get adequate sleep. So that is why I tell most of my young patients that, cut down on your time on Facebook, and cut down on your time on, just watching TV, and see that you sleep early. And it's a matter of a habit. Patients say, neend nahi aati hai. If you're tired, you will get sleep. If you're not getting sleep, that means you're not having a very productive day. You're not really working enough.
Very difficult with youngsters. That's the time that they chat with another time.
Yes.
My daughter comes home and that's the time that she's connecting to all her friends, and it goes on. We've gone to sleep.
But that's the problem.
So that becomes a problem.
Yeah, but you can cut down on the time. You cannot just keep chatting for 2 or 3 hours. She needs to do, because you will see automatically it does affect health. There are some people, there's a lot of problem with sleep apnea, because snoring habits. People are snoring. That means again they are not healthy. They are at risk for getting cardiovascular problems. And you need to actually, today there are monitors which actually check whether you've got sleep apnea. And 7 to 8 hours is at least what you need to sleep. 7.5 hours to be accurate is what you need to sleep in a day. And it's very important. And today's generation, they sleep at 2 o'clock, then again they get up at 6 o'clock. They're very irritable. And you will see that they don't look fresh in the morning. They just don't feel fresh and energetic. I'm sure people who get up early, I always tell people, it's a matter of habit. It takes 21 days for you to make a habit, for something to happen. So if you say that I've done it today, I've done it tomorrow, and it's not working for me, it doesn't work. You have to do it for 21 days for it actually to become a habit. So that is something which is very important. I tell my patients, do it, and after some time you will see it has become a habit and you will not like doing it anywhere else. Okay, so that is something which you could do and try. So you must have heard the saying, longer the belt, shorter is the lifespan. I always tell my patients that when you go and buy a belt, especially for the men, mark the belt, that this is where 90 centimeters is or 35 inches is. And every time you put the belt, try and reach the belt towards that, that is your target. you will make an effort then. If you do not have a goal, you will not make an effort. For women also, you know, at times we wear those loose salwar kameezes or saris, and then it's, you know, it's very easy to hide the fat. Try and see that what is the outfit I want to wear, and have that goal in mind and work towards that goal, that I have to fit into this outfit, you know, and then only work backwards and say that within so many days I am going to try and lose weight or do something about myself. Now, as I told you that Indians are called thin fat people. Okay, now there are machines which are called body composition and analyzers, which actually test how much fat you have in your body. Okay, now we've done a lot of screening programs, and we've seen that the women have a body fat percentage of anyways between 35 to 42%. The amount of fat in the body is very high. Women are supposed to have some amount of fat is because they are childbearing. But when it goes over the limit, then that causes a problem to them. Post menopause, the amount of fat actually increases. Okay, so what is the cutoff? You know, ideal amount of fat that a male should have in his body should be less than 21%. For a female, it should be less than 26 to 28%. If it's more than that, that means you have to work towards bringing it down. I cannot tell a person who's 42% that no, next week you have to bring it to 26. But at least work at bringing it down slowly and gradually. You know, that should be your focus and that should be your aim. More than the weight, it should be about the amount of fat in your body. And always remember that when you lose fat, you should try and gain more muscle. Because muscle has a higher metabolic rate. Muscle burns more calories. So if you have more muscle in your body, you will burn more calories, you will lose weight faster, you will be a more healthy individual. And that is why we talk about protein. Today there's a lot of talk about taking high amount of proteins. Why? Is because we've seen that Indian diets, especially vegetarians, we eat very little protein. Okay, because if we are not having enough of milk, and we, you know, today everybody is talking about the vegan diet. You know, it's becoming very prominent. People are saying don't have dairy, don't have milk, don't have any non-veg. Then where is the protein going to come? They advocate that you take protein from your pulses, you take protein from nuts, and if you cannot afford nuts, yeah, peanuts is what they advise, but then not everybody can do a vegan diet. So if you're a vegetarian, you have to really focus on bringing protein into your diet. Anybody who's vegetarian here? Okay, so what do you take in protein? Let me know. How much of sprouts? Okay, and milk, how many cups? Not milk. So if you don't take milk every day?
1 glass of buttermilk.
Okay, and you take sprouts?
Yeah, and milk goes half a cup in the tea.
That's it. So if you look at her protein consumption, it's not even coming to 20 to 25 grams of protein in a day. Okay, now we need to add protein. So for vegetarians, how do we add protein? There is soya that you could add. You know, you get soya paneer, which is called tofu. You get soya milk, which is there. You get sprouts that you could add. When you're making your chapatis, you could add a little bit of your dal into it, so that you knead the atta with the dal. It tastes also good, make like a paratha without the oil. And
You should not mix two cereals together.
two cereals, but dal is not a cereal. Dal is a protein.
Yeah.
Dal is a pulse, and your cereal.
Chapati.
Yes, you could. No, what I'm saying is you could add it when kneading, especially for children, because mothers are always worried, you know, how do we add more protein to our child's diet, because our child does not like to have dal, doesn't like to have vegetables. But can we make something like a roti which looks colorful? You know, spinach pureed and vegetables grated. Even when you're making a dosa, if you could grate vegetables and put it, looks colorful and nice, and children like it. So mothers are always constantly worried that what do I give my child for tiffin every day. So we give these suggestions that you could offer. Okay. Now the most important thing is, why do we say that people who are overweight get diabetes? Anybody can tell me? Why do people who are overweight are at more risk for getting diabetes? Is there any link? Liver, okay. Now what happens is, suppose I want to enter this room, okay, if you want, imagine it to be a room which has got two doors to it. Now what happens when you eat? Whatever you eat, whether it's your carbohydrate, protein, it's your roti, dal, whatever, everything gets converted to sugar. It gets converted to glucose in your body. And glucose is very important. You cannot be zero glucose. Glucose is to your body what petrol is to the car. So if there's no petrol, your car will not move. Right? So petrol is very important, your glucose is very important. The problem happens when it goes in very high amounts and when it goes very low, because your brain cannot do without glucose. So the glucose enters the blood. This glucose will go and knock the door of the pancreas, which produces insulin, and tells the pancreas that please release insulin or secrete insulin. And insulin is what? It's your key. So the insulin comes and it goes and opens the locks of the cells. It opens the locks, and then what happens is glucose enters into the cell and glucose gets converted to energy. Now I give you a scenario. This happens in normal scenario. Now when you have too much of fat in your body, now every cell has got a lock, right? And the key is there, which is your insulin. So your keys are being produced, but what is happening is because of the high amount of fat in your body, cholesterol, triglycerides and all that, that comes and sits on the lock, on the keyhole as sellotape. So it's like you put a sellotape on the keyhole. Now I have my key, can I open the lock? I cannot. Why? Because of the amount of fat which is there. That's why we say that when you put on too much weight, the free fatty acids, the triglycerides, the cholesterol comes in the way of the insulin. It does not allow the insulin to work. That's why the first principle for somebody who is overweight and has got diabetes, the first thing that we tell the patient is lose weight. If you lose 7% body weight, automatically your sugars come under better control because your insulin works faster or better. So even if your husband who is on medications and if his weight is more or he's got too much of fat in his body, then what we need to work at is, can we help him reduce fat? Can we help him reduce weight? Because automatically the amount of medication that he needs will reduce, and that should be the focus. So when we talk about sugars, it's not only sugars, it's weight, it's your blood pressure, it's your cholesterol, and it's everything in totality, and this is what we should target on. You'll have any questions, you can ask me. I hope this is clear. So always remember the sellotape and the key. The key is your insulin, the sellotape is the fat on the lock. So the only way to allow your key to work or allow your insulin to work is to remove the tape, which is your fat. So that's why it's important to cut down on your weight. Now what are the normal sugars? Have anybody of you all checked your blood sugars? Other than you?
For breakfast,
How much is it?
should be within 110.
110.
And after eating, it must be below 150.
Okay.
One is before fasting is 86.
Very good.
And around 120,
Okay. You've checked yours?
Mine was normal. But
Okay.
my husband says whenever it is in the evenings, it is very higher side, 200. In the morning,
Is he eat-
135, 150. Like that.
But evenings. So maybe what he's eating in the evening could be causing that spike, or maybe the medication that he's taking needs to work at that time. If it may be not sufficiently working at that time. So we'll have to